Okay, Assalamualaikum warahmatullahi wabarakatuh, and good evening to everyone. So for today's CME, we will be presenting on the topic medical imaging in pregnancy, imaging risk and management. So my name is Cme Presentation,
And my name is Johanna,
and we will be the presenters for today. So now that I've introduced the topic, so let's dive into a few key aspects that we will be presenting for today, which includes the introduction, effects of radiation to embryo and fetus, imaging risk, ethics and legal guidelines, imaging protocols and safety consideration, controls media usage, and conclusion. So for introduction, as we all know, medical imaging plays a vital role in diagnosing and aids of treatment. However, when it comes to pregnant patients, there is additional approach of cautious. So this is because fetuses are significantly more sensitive to radiation than adults, and radiation exposure presents some risk to fetus known as teratogen, which is an agent that disrupts the development of embryo of fetus, and carcinogen, which is an agent that can cause cancer further in life. So with this concern in mind, I will also emphasize the importance of applying IR principle, which is keeping radiation exposure as low as reasonably achievable as a cornerstone of safe and responsible imaging procedure. So ALARA is a fundamental radiation safety that is aimed at minimizing radiation exposure to both patients and healthcare workers without compromising the quality care and the diagnostic value of image. Lastly, the ALARA principle is based on the assumption that no level of radiation dose is safe. Therefore, every small doses carries a potential for biological effects, especially in vulnerable populations such as pregnant patients and fetuses. So with that overview in mind, let's now take a closer look at one of the most critical aspects of this subject, which is the effects of radiation to embryo and fetus. So due to ethical purposes, research on fetuses are complicated and often become inconclusive due to limited data. Therefore, the effect of radiation on fetus has been derived from animal studies, human exposure to diagnostic and therapeutic radiation, such as atomic bomb radiation at Hiroshima and Nagasaki in 1945, and the fallout of Chernobyl nuclear power plant explosion in April 1986. So there are a few factors that affect the fetal risk, such as firstly, the amount of dose. Higher dose procedures give higher dose radiation to fetus and thus increases the risk. The second factor is stages of gestation during the exposure. So risk is most significant during organogenesis during the first trimester, less in the second trimester and least in third trimester. So for pregnancy, it can be divided into three phases, which is the first trimester, second trimester, and third trimester. So during the first trimester, which is the first to 12 weeks, this is the period of rapid development of fetuses, whereas the baby develop their body structure and major organs are formed. So during the second trimester, which is 13 to 27 weeks, the fetus continue to grow and organ systems start to mature. And for the third trimester, it is when the organs also still maturing and fetuses gain weight and prepare for birth. So other than trimester, pregnancy can also be divided into stages of gestation, which is pre-implantation, organogenesis, and fetal period. So pre-implantation and organogenesis occurs during the first trimester of the pregnancy. And meanwhile, fetal period occurs during the second and third trimester. So for pre-implantation, it occurs during the first to 2 weeks after fertilization, organogenesis during the 2 to 8 weeks after fertilization, and fetal period during week 8 until birth. So according to stages of gestation, the embryo and fetus react differently to radiation exposure. So during pre-implantation, which is the fertilization of egg and implantation in the wall of uterus, the embryonic cells are rapidly growing and not well differentiated yet. So if exposed to any radiation, it uses all of melting principle, which is either the embryo fails to implant and dies, or it is unaffected and survives without any risk of malformation. So during organogenesis, if the embryonic tissue are not differentiated into major organs, so a dose of more than 100 mg may lead to death of embryo or malformations. Therefore, conception is most risk at this stage. And lastly, the fetal period, it is characterized by rapid growth of the fetus. So the central nervous system of the fetus is most sensitive during the 8 to 25 25th gestational week. This is because during the 8th to 17th week, the number of neurons in the developing brain increases rapidly and neurons move into specific parts of the brain. But after 17th gestation week, no further cells division occurs in the fetus's brain. Therefore, high fetal doses during the late pregnancy, more than 25 gestational weeks, are not likely to result in any malformations. So when we talk about radiation dose effects to human, it can be divided into two effects, which is deterministic effect and stochastic effect. So what is deterministic effect? Deterministic effect is a predictable effect that occurs when dose crosses a certain threshold, and it also involves in cell damage and death. So usually deterministic effect can be visible to our eyes. So the key concern with deterministic effect is teratogenesis. So teratogenesis is the process that leads to birth defects. So it can be structural, like missing limb or cleft palate, or it can be functional, like intellectual disability. So during the deterministic effect of pre-implantation stage, as I mentioned before, it is all or none effect. Because cell just started to develop, therefore it is sensitive to radiation. However, it will not cause any malformation during the delivery stage. So next is the organogenesis stage, which is 2 to 8 weeks after fertilization. So this is when the fetus is most sensitive. So some of the potential injury that can cause from radiation is microcephaly, microphthalmia, mental retardation, and intrauterine growth restriction. So during the second and third trimester, major organs have formed, and cell injuries are of minor concern. So next, for the stochastic effect. So stochastic effect is random and with no threshold. It can occur at any radiation dose, as low as 0.001 milligrade, even very low levels. So as you can see in the graph next to the text, for stochastic effect, it does not have a threshold level, and cancer risk increases linearly with those linear no threshold model, meaning that it can occur at any stage, and increase in radiation exposure also means increase in cancer risk. And also, why is stochastic effect dangerous? Because it may not appear immediately. So for fetuses, in case of fetuses, so if a patient is exposed to radiation, the stochastic effect of it is that the fetuses can have cancer later in life, maybe 20 years later. So the consequences of stochastic effect is genetic mutation, result in carcinogenesis. So carcinogenesis is the process of transformation from normal cell into cancerous cell. So as we know, sometimes radiation are powerful enough to give damage to our DNA, which is the deoxyribonucleic acid damage. And sometimes when the cell repair itself, it may not repair properly and may cause the genetic mutation. Okay, so the deterministic and stochastic effect can be simplified into this graph, which is for this deterministic, it is an exposure at high radiation dose, which is early and predictable effect. Meanwhile, stochastic, the severity is independent of the dose and occurs at any amount of ionizing radiation. It is late and non-predictable.
So now I will explain imaging ways for imaging the product ionizing radiation. So in this slide, we focus on X-ray imaging and its associated with fetal radiation rays. Conventional X-ray assumes that do not involve direct exposure to the abdominal, that do not involve direct exposure to the fetus or the abdominal area, generally result in almost zero radiation exposure to the fetus. So this means that most general X-ray considered safe in terms of fetal radiation. Even if the fetus is in the field of view during the examination, so no single diagnostic X-ray has radiation dose significant enough to cause adverse effects in developing embryo or so the estimated radiation dose to the fetus can range from 0.001 milligrade to 10 milligrade depending on the type of study. So for example, lumbar spine X-ray may contribute to higher dose with a maximum dose of up to 10 milligram, but even in these doses remain below the threshold of 50 milligram, which is considered the safe exposure limit to prevent significant harm. And as shown in the table, the approximate fetal doses for common diagnostic procedure vary, which is a chest X-ray result in a negligible dose of less than 0.01 milligram, while an abdominal X-ray has a mean dose of 1.4 milligram and can reach to a maximum of 4.2 milligram. And while most X-rays procedure involve low doses of radiation, it is important to note that CT scans tend to deliver much higher doses. For instance, an abdominal CT scan results in doses as high as 49.6 milligram, and therefore, while routine X-ray are generally safe, CT scan and fluoroscopic exams which involve higher doses of radiation should be used cautiously, especially during pregnancy. In this slide, we've explored the radiation exposure level from X-ray procedures and the specific content regarding fetal safety. So as you can see, the lumbar spiral graph, which has a maximum dose of 10 milligram, result in a higher dose compared to the other X-ray. Higher dose compared to other X-ray exam. However, even with this dose, it remains significantly lower than the 50 milligram threshold that is significantly lower, that is considered the safe limit for preventing harm to the fetus. Next, so this threshold is crucial because it helps guide the assessment of risk when conducting imaging procedure on pregnant patients. A dose greater than the 50 milligram could pose a risk to fetal development, but doses below this level are generally considered safe. And also, it is important to note that the caution should be taken when multiple radiographs are conducted, especially in trauma cases. In such cases, the cumulative dose could increase and may exceed safe limit. This is particularly relevant in emergency situations where several X-ray procedures might be necessary and careful consideration of total radiation exposure is critical. So, the table on the right also provides a breakdown of fetal doses from different diagnostic procedures. For example, lumbar spine X-ray have a higher dose up to 10 milligram, while abdominal X-ray have a mean dose of 1.4 milligram with a maximum dose of 4.2 milligram. And then chest X-ray have the lowest radiation exposure, generally resulting in doses of less than 0.01. So by reviewing these numbers, it's clear that the radiation exposure from most X-ray procedure is quite low and is safe for the fetus. But however, careful considering and justification of imaging procedure are crucial, especially when higher radiation doses like those from CT scan or fluoroscopy are involved. So next, we focus on CT scans, which becoming increasingly common in medical practice due to their ability to quickly detect or rule out emergency situation, particularly in maternal care. So one of the main advantages of CT scans over MRI is their speed and ease in acquiring image, which make them an ideal choice in urgent clinical setting. So this is one of the reasons why CT scans are often preferred when immediate results are needed for the diagnosis of emergency conditions. However, the primary limitation of CT is that it uses ionizing radiation, which will result in higher radiation doses compared to conventional X-ray. the doses that associated with CT scan are concerned, especially when it comes to the fetal exposure during pregnancy. And then ionizing radiation can pose risk to the fetus, and CT scan should be used especially in pregnant patients. While CT doses are higher, the radiation level used in routine CT examinations, including abdominal pelvic scans, generally do not exceed 100 milligram. And then this is a critical threshold, as doses lower than 100 milligram are not associated with an increased risk of birth defects, miscarriage, or other pregnancy complications. So, for example, an abdominal CT scan result in a fetal dose of around 8.0 milligram, on average with the maximum dose possibly reaching to 49.6 milligram. So, but depending on the procedure. So, despite these higher doses, this level are still considered within the range of the safe exposure. So, as we can see in the table on the right, CT scans for abdominal and pelvic regions involve relatively higher doses compared to other common procedures. For instance, an abdominal CT scan may expose the fetus to 8.0 milligram, while a lumbar spine X-ray typically result in much lower doses, around 1.7 milligram. So this highlights the importance of critical justification when opting for a CT scan during pregnancy. CT scan should only be performed if the diagnostic benefits outweigh the risk posed by radiation exposure to the fetus. Moving on to the next slide. The table shows the potential effects of radiation exposure at different stages of pregnancy depending on the gestational age and radiation dose. And for example, during the 0 to 2 week stage, when the embryo is most sensitive to radiation, there is no evidence that the doses under 50 mg cause any malformations. In fact, exposure at this stage would most likely lead to embryo falling so apart or surviving without malformations. From 3 to 4 weeks, exposure to low doses of radiation still does not result in any significant effects, but higher doses could lead to spontaneous abortion. And then from 5 to 10 weeks, during organogenesis, when major organs are developing, the fetus become more sensitive to radiation. But although lower doses may not cause detectable harm, high doses can result in malformations, and the risk increases as dose rises. From 11 to 17 weeks, the effects of low radiation doses are still minimal, but higher doses could lead to developmental issues such as deficits in IQ or mental retardations. These effects tend to increase in frequency and severity with higher dose. So, in the later stages of pregnancy from 18 to 27 weeks and beyond, radiation exposure at diagnostic doses does not result in the detectable harm. However, higher doses can still have an impact with IQ deficits and other developmental issues becoming noticeable as the dose increases. So now I will be explaining about radiation risk for pregnant patients. The first one is miscarriage. So it can happen when high radiation doses from exceed 50 to 100 mg during the first 0 to 2 weeks of pregnancy before implantation. It can cause spontaneous abortion, which is miscarriage due to damage to the developing embryo, either causing it to stop growing or preventing implantation in the uterine cord. And then the next one is fetal malformations. So it can happen when the radiation exposure during the organ formation phase from weeks 2 to 8 weeks. When fetal organs are developing, it can cause birth defects in the developing heart, brain, spine, and limb, as radiation can disrupt the normal cell division process that form these organs. And then the next one is intrauterine growth restriction, IUGR. So, radiation exposure that disrupt the placental function, affecting nutrient and oxygen transport to the fetus. Basically, it can slow the fetal growth and potentially leading to a low birth rate or developmental delays. And then urogenital malformations. So, with high levels of radiation exposure greater than 100 milligray, it can lead to abnormalities in the development of the kidney, bladder, and reproductive organs in the fetus. And then the next one is skeletal abnormalities. So it can happen when the exposure to significant radiation doses greater than 100 milligray. Basically, it can cause the bone malformations, venous vertebral or fractures in the developing fetus. And then neurodevelopmental delay or intellectual disability. Radiation exposure between week 8 to 15 of pregnancy, when the fetal brain is highly sensitive, it can cause cognitive delays or intellectual disabilities due to disrupted brain development. And then microcephaly. Radiation exposure during early second trimester, which is 8 to 15 weeks, neuroprogenitor cells in the brain, and basically will reduce the brain size, which can lead to the developmental delays and cognitive impairments. And then the next one is childhood cancer. So even with the low doses of radiation, which is 10 to 20 milligray, during any stage of pregnancy, it will lead to cellular mutations that can increase the risk of childhood cancer, such as leukemia or brain tumors due to mutation in cells that could lead to the cancer later in life. And then fetal hematopoietic dysfunction. So, radiation doses that exceeding 100 milligray can interfere with normal blood cell formation in the fetus and potentially leading to conditions such as anemia or other blood-related disorder post-birth. And then the next one is thyroid dysfunction. So, radiation exposure from radioactive iodine, which is iodine 131, which the fetus thyroid absorbs after 10 to 12 weeks of pregnancy, will affect thyroid dysfunction and leading to metabolic or growth issues in the child, as the thyroid regulates crucial body functions. And then hearing loss of deafness. It can happen when the exposure to radiation, especially during the early stage of pregnancy with doses greater than 100 milligray, significantly increase the risk of hearing impairment or completely deafness in the infant. So, next one is growth delay or stunted growth after birth. Radiation exposure that particularly at doses above 100 milligray can adversely affect post-birth growth and result in delayed physical development or hormonal imbalance leading to the growth delay or static growth of the. And then the last one is cataract. Radiation exposure during pregnancy, particularly at doses exceeding 200 milligrade. Basically, it can lead to the development of congenital cataracts, which may result in impaired vision outcome.
Okay, so other than ionizing radiation, non-ionizing radiation can also cause imaging risk for fetus. Okay, so for MRI, currently no harmful effects have been documented on developing human fetus exposed to different MRI fields, 1.5 or 3 tesla used in clinical practice. However, potential risks are only theoretical and related to specific MRI technical parameters. So there are several theoretical risks of MRI arising the effects of risk to fetus, which is static magnetic field V0, time-varying magnetic fields, and radio frequency pulses. So some of the risks MRI can cause, which it is tissue heating and potential impairment of fetal hearing. So MRI during the first trimester is absolutely prohibited. So this is because theoretical risks during the first trimester will include a disruption in cell proliferation, migration or differentiation, and damage to cells on organ system due to heating. This cell damage could either result in miscarriage or potentially injury to specific organ systems. So exposure to RF forces may also result in tissue heating and damage during the organogenesis stage. And annual research has been conducted during the first trimester of pregnancy, documenting growth restriction, eye abnormalities, and miscarriage. Although this study may not be generalizable to humans. So regarding tissue heating, however, when we scan a pregnant patient, the tissue heating is most concerning at the front part of the scalp, front part of the tissue. Therefore, so when we scan the pregnant patient, the tissue proximity is almost negligible at the center due to anatomical positioning. So this has been considerably lower than what has been shown to cause detrimental effects. So for MRI during second and third trimester, during the second trimester, we will still prefer if we can delay the imaging to the third trimester or even after the baby is born. So major organ system has formed and disruption of in-cell migration or differentiation are no longer as a large of concern. However, risk relates to fetal hearing in that rapidly switching breathing fields in the MRI may lead to high level of acoustic noise in close proximity to the mother and fetus in the junction. So according to American Academy of Pediatrics, acoustic noise level during the scan should not exceed 90 decibels. However, the maternal body will attenuate the noise by 30 decibels, and the aortic fluid coating the baby will insulate the auditory canal or the fetus. So when we talk about pregnant patient, we also have to talk about ethics and legal guidelines. So consent form is extremely important because consent form is we need to check. Consent form is important before doing any examination because it protects both the patient rights and also the radiographer in charge that are doing examination. So this consent form it serves as a proof that the patient is screened and also explained beforehand about the risk of the examination. So therefore, when we perform the examination, our responsibility do not lie on the harm to the fetus. So, but even if the responsibility do not fall on the radiographer, we still need to check the consent form and need to check the consent form whether it is declared by the specialist or by other doctors. Consent form is only to be declared by specialists only if the patient is incoming to the X-ray or any modalities signed by other doctors such as LISHO or MO. The eligibility of the consent form is invalid. So therefore, radiologists need to be consulted if such situation occurs, and other doubt about examination arises, such as if the requested part is at the right side, but the patient complains on the left side. Therefore, radiologists also need to be consulted.
imaging protocols and safety considerations. So these are the general rule that we need to basically it's like a protocol. So the first one is justification. No practice shall be adopted unless its introduction produces a positive net benefit, meaning the benefits outweigh the risks. And then the next one is ALARA principle. So Atomic Energy Licensing Basic Safety Radiation Protection Regulations 2010 issued under 304. So all exposures must be optimized to keep radiation doses as low as reasonably achievable, which is the ALARA principle. And then the next one is the consent form. So we need to ensure that the consent form is signed by patient and specialist before proceeding with any